Evening, and welcome to everyone joining us here today. My name is Shayla Favor, and I serve as the chair of City Council's Criminal Justice and Judiciary Committee. I'd like to officially call this hearing to order. We are hosting this hearing to discuss the proposed three-part common sense gun reform legislative package in the city of Columbus. Tonight's public hearing is designed to give residents and stakeholders the chance to hear and comment on details of the ordinance being considered by council. The proposed legislation is live and can be downloaded at www.columbus.gov/common-sense-gun-legislation. A few months before I joined council in 2019 was a day Ohio communities would always remember. Just miles outside of the community in Dayton, Ohio, an armed gunman headed to the Oregon Entertainment District and proceeded to carry out a mass shooting in which 9 people were killed and 27 were injured in just 30 seconds. And last Saturday, 5 lives were taken in a matter of minutes. Mass shootings have become all too common, and right here in Columbus, we have seen how gun violence has ripped through our communities, and especially amongst our youth. The truth is, we know that we can do so much more to stop devastations like these. It's common sense gun laws. That is why tonight, we are putting forward a 3-part common sense gun reform legislative package. This is about keeping guns out of the wrong hands, advancing gun safety, and most importantly, protecting our community. It is now my honor to introduce Council President Shannon Hardin with any brief remarks you might have.
Thank you, Madam Chair. I want to thank both the co-chairs of this hearing, both Councilmember Remy and Councilmember Favor, for bringing us together. This is the people's house. This is where we come together as a community to discuss, deliberate, and then vote on, make decisions about the most pressing issues of our time. That's why this evening's conversation is so important, because there cannot be any more pressing issue than that of gun safety in our community and around. The 3-part legislation that the chairs will put forth and we will discuss this evening, we believe are common sense. We believe that most of all gun owners, especially responsible gun owners, support this type of legislation. This is not anti-gun. This is pro-safety. And we look forward to hearing from everybody, folks who are going to be supportive and folks who are not. We understand. But this is where we'll have a conversation that will be, we will listen to each other. We will not go after one another, but we will have a conversation and we will deliberate, and then we will move forward quickly with legislation. So I'm just grateful for this hearing, and thank you so much, Chair, for calling it.
Thank you, Council President Hardin, as well as my co-chair, Councilmember Emmanuel Remy, Chair of the Public Safety Department.
Thank you so much, Chair Favor. Thank you for bringing us all together. As Council President said, this is an important topic for the safety of our community. This is the true definition of common sense. And so as we hear the proposals this evening about what is being proposed, especially when we look at how we are hamstrung and losing our home rule by our legislature just up the street at every opportunity, we look forward to bringing back some common sense to this community. It's an important topic, and it's an important step in the right direction, especially when we think about our first responders as they go out every day keeping us all safe. It's also incredibly important that our residents feel safe. As I said at the press conference earlier this month, we need to tackle crime and respond to calls for service from every direction, whether that's alternative crime crisis response, having a real-time crime center in this community, additional police and fire classes throughout the next several years, and having common sense gun reform. This is one of the reasons that I am very supportive of this project and look forward to working with the chair beyond this tonight. And as we bring this legislation to the table and on the floor, we will continue to work stridently together to make sure that we are tackling this issue that has become a plague on our streets. So I look forward to the presentations this evening and hearing from our public testimony speakers. So back to you, Chair Faber. Thank you.
Thank you, Council Member. And we are honored this evening that we have joining us this evening, Mayor Ginther. We could not ask for a better leader or advocate in this space who has been outspoken about the need for us to move with a sense of urgency in this space. It's now my honor to turn the podium over to Mayor Ginther.
Thank you, Council President Harden, Council Members Faber and Remy, and City Attorney Klein. I want to thank you all for the invitation and the opportunity to join you this evening, and I want to thank everyone who is here tonight and tuning in virtually as we battle back the menace of gun violence and work to realize reasonable, common sense gun safety measures to protect our neighbors. Make no mistake, we have an epidemic on our hands. For the first time in American history, Center for Disease Control reported that more children died from gun violence than from car crashes or any other cause. First time in the history of the Republic. Think about that for just a moment. How much our world and the dangers to our children have changed within such a short span of time, well within all of our lifetimes. Just like so many communities across the country, our city is being robbed of our most precious asset, our people, by gun violence. Last year, 91% of the homicides committed in Columbus involved the use of a firearm. The proliferation of guns in this community and communities across the country. At the same time, state legislatures turn their backs on the people they take an oath to protect. So far this year, Columbus police have confiscated nearly 3,000 guns, nearly 200 of which were assault-style weapons. Let's remember, there was a federal assault weapons ban in place from 1994 to 2004, and it worked. Research has shown that during that ban, the risk of a person in the U.S. dying in a mass shooting was 70% lower. Studies also conclude that had the ban remained in place, it would have prevented more than 300 of the mass shootings we have seen since, saving hundreds of lives just recently, this past weekend, in Colorado Springs. Not surprisingly, since the ban expired, the number of those killed and injured with assault weapons has increased. It's not just in mass shootings and in faraway cities. Right here in our city, a son of the Mahoning Valley, an honor student at Youngstown State University, was shot in the crossfire. Kevin Sabonsky, when he and his friends stopped just to get gas. And almost a year ago, Charles Wade and Demetrius and London Walneal, ages 9 and 6, were gunned down by assault weapons fire. States that have passed careless and reckless laws like Stand Your Ground under the guise of safety, turning their backs on law enforcement, prosecutors, first responders, have all seen an 11% increase in homicides by firearms. Again, hundreds of lives that could have been saved with common sense gun laws. The disproportionate impacts on gun violence fall on our black and brown neighbors. It's staggering. Nearly 80% of the victims and perpetrators of gun violence here in our city are African American men between the ages of 18 and 40. Data from the CDC shows that Black Americans are at least 4 times more likely to be killed by a gun than the overall population, and 12 times more likely than a white person to die from a firearm. If we believe that racism is a public health crisis, and that gun violence is a public health crisis. And we know the statistics and the data. It is incumbent upon us to act. But the devastation doesn't end there. The effects on mental health and personal well-being are persistent, pervasive, and often extremely debilitating. The issue is both urgent and complex, but it isn't without viable options. That's why earlier this year, we declared gun violence a public health crisis and charged our health commissioner, Dr. Mashika Roberts, with examining this issue from every angle, but particularly through a public health lens. Think about it. If a segment of our population was dying because of a virus or some kind of a disease, we would leverage every tool to analyze the situation, incorporate the latest data and research into our response, move with deliberate speed and intent to treat the symptoms, prevent the emergence of new infections, and eradicate, to the best of our ability, the most lethal threats to public health and safety. We can do this. The power, the data, the information is in our hands if we have the courage to act. Why would we view gun violence any differently? This is what this situation demands. This is the response our residents deserve. Our city's comprehensive neighborhood safety strategy is just that. It's comprehensive, it's holistic, it encompasses prevention, intervention, and enforcement techniques, and it continues to grow and evolve with each passing year. I'm proud to say our efforts are paying off. Homicides are down by more than 30% year to date over last year and more than 15% lower than 2020, thanks in large part to the hard work of our officers and our community working together. But that is no thanks to a reckless, wild, wild west state legislature, which has passed dangerous laws that allow residents to carry a concealed weapon without a permit, and they don't even have to tell police officers they have a gun if they're stopped. Residents are at a greater risk of violence because of these laws, and so are our first responders, police officers, and EMTs. This legislature has chosen to stand with extremists. This city stands with police officers, prosecutors, firefighters, EMTs, and moms and dads. What we have right now is a unique opportunity to kick our crime-fighting tactics into high gear. I'm a strong proponent of common-sense gun safety laws, and I have always been a strong advocate in partnership with this council and our city attorney. I want to thank them for contributing their resources and expertise to this incredibly important work. This is not about eliminating the right to bear arms. Every constitutional right comes with responsibilities. It's about doing everything within our power to keep guns out of the hands of those intent on using firearms to maim, murder, and destroy our communities. Under active consideration here are reasonable measures like limiting magazine size, restricting unauthorized people from selling guns, and promoting safe storage of all guns. We're also looking at how to restrict assault weapons and weapons altered to act as assault weapons. Because let's be honest here, assault weapons aren't for protection or hunting. They're designed to kill as many people as possible in the shortest amount of time. They are weapons of war, and they do not belong on our streets and in the faces of law enforcement and first responders and children. There's a growing consensus across all parts of the political spectrum that meaningful, sensible action is warranted. In fact, 80% of Americans support common sense gun safety measures, Republicans, Democrats, Independents, bipartisan groups, including the Ohio Mayor's Alliance and the U.S. Conference of Mayors. This is not a partisan issue. This is a community issue. And by raising your voice, taking action, and standing up for the safety and security of our families and our neighborhoods, I have no doubt we will solve it together. But friends, the time for talk is over. The time for study, the time for delays, the time to act is now. This is our moment, and we need to take it. Thank you, Mr. President.
Thank you. Thank you, Mayor Ginther. We could not do this without strong leadership and strong advocacy. You know, tonight you're seeing an incredible demonstration of commitment to addressing the violence, and more specifically, the gun violence in our community, as we are also joined by City Attorney Zach Klein. City Attorney Zach Klein, I'll turn the podium over to you.
Well, thank you, Chair Favor, Chair Remy, Council President Hardin, Mayor Ginther. Mayor, those remarks were spot on. I could not disagree with one thing that you said. We were together about a week ago for our press conference, and in the intervening time over the past week, there's been countless shootings on the streets of Columbus and across the United States. There have been, obviously, the tragic, awful event that happened in Colorado at a LGBTQ nightclub. I've been very straight with the people of the city of Columbus and with my colleagues, elected leaders here, that with the pending litigation that we have in the Franklin County Court of Common Pleas, we do have this unique opportunity that's been not present for cities over the past decade or so because of state preemption laws in Ohio, for cities like Columbus to regulate and to figure out how to deal with, based on the unique circumstances of any particular city, firearms on the streets of their city. We don't know, I can't predict the court of how long this will last, but all I can say is right now we're here and we have the opportunity. And this opportunity is golden. It's a time for us to, for the first time in a while, to add a legislative strategy to the work that we're doing in the city of Columbus to keep violence away from our families and our friends. Of course, we have to continue investing in our police officers and supporting law enforcement to get guns off the street, hire more officers. We have to continue what this council has done well in investing in people and violence interrupters. But this legislative strategy is one that's practical and effective, and it's reasonable to help end the chaos on the streets, grocery stores, places of worships, and nightclubs. So these mainstream, practical, and effective ideas, I think, protect our neighbors, protect our children, protect law enforcement, and protect our families. So I'm happy and proud to be part of this effort, grateful for the opportunity to speak tonight, and for my Chief Counsel, Laura Baker Morrish, to walk through the ideas being proposed as a first step to do reasonable, common sense ideas that can protect our children. Because the mayor is right, among other things that he said, that the data shows, this is not opinion, the data shows that in states like Ohio, where extreme Republican ideology that is frankly not reflective of Ohioans, but is reflective of a small group of people that control the mindset and ideology of the Ohio legislature, the data shows that in those states, violence with guns increases by 10%. That is a fact. That is not Zach Klein's opinion. That is a fact that's been researched by Johns Hopkins University and others. It's also a fact that some of the most, red states in our country are some of the most violent prone states in our country because of lax gun laws. And it's also a fact that in those same states, They lead our country in suicides because of the easy access to firearms. We have a unique opportunity and, frankly, a responsibility to do something about it. Others have failed at the state level. We will not fail here. We will proceed until we're told otherwise by a court to stop. But we will proceed because it's the right thing to do for our kids. It's the right thing to do for our families. It's the right thing to do for the residents of the city of Columbus. Thank you, chairs.
Thank you, City Attorney Klein. I want to just take a moment to thank you and your team for staying committed in this fight to press forward, even when there did not appear to be a pathway forward when it comes to legislating common sense court gun legislation. Your team was committed to working alongside council and drafting legislation, and that's why we're able to move so quickly. So thank you for availing you and your team to that effort. We are also joined by a few folks who are going to provide some introductory remarks. Anita Clark, our Assistant Health Commissioner.
Good evening. Thank you, President Hardin and Councilmember Favor and Remy. Columbus Public Health is proud to work with you on common sense policies and efforts that will help protect our residents from gun violence. Looking at gun violence through a public health lens gives us a different perspective as we work to address the crisis together. The Board of Health spent the last 6 months learning as much as they could about the issue from law enforcement, the City Attorney's Office, staff involved in this work, neighborhood leaders, community members, and people who have been personally impacted by violence. After engaging with the community and learning as much as they could from diverse perspectives, the Board of Health developed recommendations that we believe will help reduce violence, build resilient neighborhoods, and support residents' health, well-being, and safety. These recommendations build and enhance the good violence prevention and intervention work already being done, such as the Neighborhood Resilience Organizers, the More Life Partnerships, which provides trauma services with faith-based organizations, and also our CARE Coalition. Columbus Public Health also has gun lock boxes available to our community to help prevent firearms from getting in the hands of children or someone else who shouldn't have them. I brought one along tonight if anybody's interested. I have one here. To date, we've distributed nearly 1,000 lock boxes to our community residents, and you can visit our website for more information on getting a free gun lock box, as well as education on how to store that gun safely. While we've had great programs in place with more to come, we know that there are no quick and easy fixes to gun violence. Columbus Public Health is committed to working with all of you to find long-term solutions that will make our community safer and healthier. This hearing is one more step in that right direction that we are confident we can have in a positive impact on gun violence when we are all working together. Thank you.
Thank you, Ms. Clark. Do any of my colleagues or Mayor Ginther, City Attorney Klein have any questions for our Assistant Health Commissioner? And I think Mayor Ginther did an amazing job answering the question I'm getting ready to ask you. But as a health professional, in 2020, the City of Columbus and Franklin County did declare racism to be a public health crisis. Why is gun violence a public health crisis that the City of Columbus should address?
It's really causing a loss of life in our community. And as a social worker, the trauma that is affected by a homicide or a gun shooting is traumatic to not only that person, that family, the neighborhoods, the community in general. And it's really the trauma that impacts our community and the mental health of our community. And we really need to look at this holistically from a perspective in different perspectives.
And I think, when we think about specifically the greatest impact, gun violence is impacting all of our residents, let's be clear about that. But if we think disproportionately how it's impacting certain communities in the City of Columbus, that lends itself to fit squarely within the definition of a public health crisis. Would that be accurate?
That is absolutely correct.
Thank you for that. Next, we are joined by Dr. Deshpande with Ohio Health.
Thank you, Chairs Favor and Remy and Council President Hardin, for the opportunity to share some of my thoughts and experiences about patients who have been injured due to firearms. I'm a trauma surgeon at a Level 1 trauma center in Central Ohio, and I get the honor to treat patients who are experiencing the highest acuity injuries. And I am continued to be humbled by the tenacity, but also the fragility of the human body. While there are many differing opinions on firearms themselves, I imagine most, or at least hopefully most, would agree that no one should die due to gun violence. Trauma centers are seeing more patients with gunshot wounds in the last few years than any time in recent history. And I'd like to take a moment to share a story about one young man who was treated by our trauma team. This patient was brought to Grant Medical Center by medics who responded to our city's shot spotter technology. When the hospital was notified, we had roughly 4 minutes to gather the team and the hospital's most critical resources to be prepared to receive the patient. When the medics arrived, they relayed to the trauma team that it was an unknown name and an unknown aged male who had a single GSW to his left chest. The patient was sweating profusely, going in and out of consciousness. And just before we performed an emergency procedure to evacuate the blood from his chest, he looked right at me, very collected, with fear in his face. And he said, "Doctor, please don't let me die. I need to go home to my son." And just like that, he drifted out of consciousness. As I made my incision, all I could think about was, I hope his son knows how much his dad loves him. When we exposed his lungs and his heart, instantly 3 to 4 liters of blood spilled out onto the cart and onto the floor. Blood was everywhere. From that tiny little wound on his chest, the bullet had destroyed his lungs and pierced into his heart. With the lack of circulating blood, his heart had stopped. While we repaired the heart, blood was being transfused into his body with the hopes that maybe it would get restarted. But after a few units of blood and no heartbeat, I had to make the awful decision to call it and pronounce the patient dead. I couldn't save that boy's dad that day. And walking from the trauma bay to the private room where our chaplains had gathered the family is almost always the hardest part of my job. I was about to tell whoever was behind those doors that their loved one had died. I witnessed that day a wife in disbelief, a mother shaking from hundreds of emotions, a cousin who was just so upset. But there he was, off to the side, a little boy, couldn't have been more than 2 years old, sitting on his grandmother's lap, completely clueless that Daddy wasn't coming home for bedtime tonight. His wife was completely grief-stricken and looked at me as if I might have an answer to her next question. And she asked, "What am I going to do now?" Sadly, this story is not unique. Trauma centers and trauma teams see the same story way too frequently. That same question, what am I going to do now? That my best friend is gone, the father of my child is gone, my son is gone, the person I share my day with is gone. I get that question all of the time, and I still don't have a great answer for any of them. I can say, though, for our community and our city, it doesn't have to be this way. Thank you.
Thank you so much, Doctor, for joining us again this evening. Do any of my colleagues have any questions for the doctor? Just a few questions on my end. How many incidents of gun violence do you say you might see on an average during a week?
During a week,
Or however you all kind of measure that?
we probably see at least 2 to 3 gunshot wounds almost every night.
Every night?
Every night at Grant. And on the weekends, it's even more.
So I'm just going to, just in case folks they could not hear you, 2 to 3 gunshot victims on a nightly basis, and that increases over the weekends. And do you have an idea of what the rate of survival is for an individual who's been shot?
I would say it varies depending on the location. Anyone who gets shot in the head, neck, or torso has a much, much higher incidence of mortality or death. In the extremities, it's much lower, but when you are hitting someone in the abdomen, there's so many vital organs. In the chest, so many vital organs. The risk goes way, way, way higher. I don't have an exact number for you off the top of my head.
Do you have an idea of how many incidents that you're, or victims that you're treating from gun violence that could be derived from negligence or misuse of guns handling?
Misuse is a very common reason for getting shot. And the problem with misuse from getting shot, it's usually someone who's cleaning their gun or putting it away and not paying attention to the safety mechanisms of the firearm. And the worst part is when it's usually near their groin because they're putting it in their pockets. And it lives right by some of the most vital arteries that go to your legs. And so if those get injured, it's minutes before they exsanguinate. So even just something so simple as putting your gun away in your holster, your pocket, or wherever, it is so dangerous if it fires.
Quality of life. If an individual who has been shot, what are we looking at as far as just recovery time and, how they're able to get back into being a fully functioning resident in Columbus?
Patients take a long time to recover. There's so many different aspects to recovery. There's the emotional or mental part of recovery, just having been through something so violent. But on the physical side, someone who's been shot in the abdomen has to wait for their intestines to recover so they can even just eat again. That can take a week. Sometimes we've seen patients who get shot and the bullet enters their spinal cord and they can't move below their waist or their arms sometimes. We have people who are shot in the head and they sustain permanent brain damage. The quality of life it can take a long time to get back to a normal life. Even the lower acuity injuries like your extremities or your arms, there's so many nerves that go into that function. So someone who uses their hands for their job, they might not be able to do that job ever again.
Who pays for the medical coverage?
To be honest with you, I don't even know, and I don't even really care. Because when they come into the trauma bay, I have no idea their name. I have no idea what they do for a living. I don't know if they're a good person or a bad person.
Yeah.
My job is just to take care of them.
And I think that question leads to my last, my final question, because when we think about how resources are spent in our community, there's the whole thought about preventative care versus reactionary care. And is it cheaper to take care of something on the front end versus the back end? So I'm thinking about the drain on important, vital resources in our community and thinking about how constrained our medical professionals are in this given time. So do you know that because we're seeing such high rates of gun violence in our community, is that putting a strain on our doctors that are available to treat, or trauma surgeons, excuse me?
Absolutely. A patient who's injured will always be so much more expensive or resource utilized compared to any preventive measure that's out there. Preventive medicine is always the best thing that we can do in healthcare. When we talk about just, injuries such as this, some of our most crucial resources include blood. And we have a nationwide shortage of blood. So much to the point that all of the hospitals just in Central Ohio have to come together to say, what are we going to do when we don't have enough blood? How are we going to organize the blood that's been donated throughout the city or throughout the state or even country to the hospitals that are going to be needing it the most? And these are conversations that we did not have to have just a few years ago.
Yeah.
And so, resources are, critical levels even now.
Thank you, Doctor. Councilmember Remy.
Over the summer, I was in Atlanta, and there were a story on about their level 1 trauma center, Grady Hospital, and so it made me think about the fact that we have 3 here in Columbus, and I came back and I talked with some folks on the fire side and the police side, but would you say it's fair to say that you have a much better a much better chance of surviving in Columbus because of that, because of the fact that there are 3 level 1 trauma centers? The point being is that our numbers are actually a little skewed potentially because we have such good medical care to keep people alive, and it shouldn't come to that, right? Back to the preventative piece, which we're trying to accomplish here today. It shouldn't come to that, but I just wanted to hear your thoughts on the level of care here, because we know that we can have somebody in a paramedic taking them into your surgery within 20 minutes. So.
Yeah, I think Columbus is uniquely positioned to have hospitals that can deliver trauma care readily accessible from any point in the city. And that is a huge benefit to being in Columbus, is just the layout of how the hospitals are and how they're connected with each other. Because when it comes to things like this, it's not about competition or who gets the most patients. It's about getting the patient to the right place at the right time, because it's all about time. And the faster you can get to a hospital that can provide you those necessary, interventions, that's going to help survival.
Thank you, Doctor. And last but certainly not least, we are joined by Assistant Chief Gregory Bodker with the Columbus Division of Police.
Thank you, Chair Faber, Chair Remy, President Hardin. On behalf of Police Chief Elaine Bryant, I'd like to offer a law enforcement perspective on this topic. Gun violence is encountered daily by Columbus police officers and many of the families that we serve. Nearly 90% of the homicides committed in Columbus this year were committed using firearms. Even those victims who survive being shot often face life-altering injuries and challenges for the rest of their lives. The violence is even more disturbing when it involves young people and involves situations that could have and should have been avoided. Our city has seen too many homicide suspects and victims under the age of 18. When children in our communities have easy access to firearms, this often creates unsafe conditions for communities and police officers alike. Every day, Columbus police officers work selflessly to remove illegal guns from our streets and from the criminals who are not permitted to carry those guns or those deadly weapons. So far this year, those officers, as the mayor pointed out, have recovered nearly 3,000 guns. That number puts us on track to beat last year's record high number of gun seizures. Just in the last few weeks, several Columbus police officers have faced life-threatening gunfire, narrowly escaping with their lives. To put the gunfire into perspective, utilizing ShotSpotter technology, from January 1st, 2021 to November 22nd, 2021, a year ago, there were a total of 18 incidents of automatic gunfire on our streets. That was a total of about 145 rounds fired. Fast forward to this year, from January to November, there have been a total of 98 incidents of automatic gunfire recorded by ShotSpotter technology, indicating that 976 rounds have been fired on the streets of Columbus. Those bullets have to land somewhere. Thanks to the dedication of Columbus police officers and strong relationships in our communities, violent crime is down this year in Columbus. Also, thanks to that collaboration with community partners, tips from family members and witnesses, Columbus is experiencing increased solve rates related to violent crimes. But our work is far from over. We can't be satisfied until everyone in their neighborhoods can walk and play in their local parks without taking for granted that they will experience some sort of gunfire. We aren't there yet. We won't be there alone. I firmly believe that with the support of the community, the leaders in our community, and Columbus police officers, we can make a meaningful difference in the city. Thank you.
Thank you. Do my colleagues have any questions for Assistant Chief? Please.
Thank you, Assistant Chief. Appreciate that perspective. Of course, it's top of mind for us up here. But one of the things I want to talk about is what happens with our officers, what happens with our paramedics when they walk up upon two children murdered in a car and and an adult murdered in the car. As I think about what happened at the beginning of this year, what does that do to our officers and our paramedics' mental health? Because they've just witnessed the most traumatic thing they probably have ever seen in their lives.
Unfortunately, Chair Remy, that is all too common for first responders. Everyone sitting behind me, we heard talk of trauma. Certainly, Columbus Public Health discussed trauma. Dr. Despande talked about trauma. And first responders experience that trauma daily. They live with that daily. And they are part of the community. So those officers on December 7th last year were not there alone. Unfortunately, they were there with community members that also experienced that trauma, helped the officers that night, the EMTs that responded, and ultimately the doctors in the ER that treated those patients when they came in. And so we talked about the lives that are saved through the police officers getting there first, to the firefighters responding, to the docs in the ER. And those networks together do save a lot of lives, but that has an impact as you move through the days and the weeks and the years of your career, and it stays with first responders.
I thought that was important to point out.
Thank you.
You think about, I know it's part of the job. I understand that piece of it, but there's no one on this earth that can handle seeing that trauma of what happened that day last year. I also think about organizations like Mothers Against Mothers of Murdered Children, and the work that Melissa is doing, and those people did not ask to do that work, that advocacy. They did not ask to sign up for that, and they certainly would wish to be doing 1 million other things than what they happen to be doing. But appreciate their support and the type of work that they're doing to help the victims of crime, because it's so unnecessary. And I think all of us live in parts of town where we hear gunshot on a regular basis. And for just last week, I got a text that my neighbor, they had bullets go through their back window during the day. They have a newborn, things along those lines that just make you think, when is this going to stop? And how can we as legislators and leaders help make it stop? So appreciate your testimony this evening, and thank you very much.
Thank you.
Councilmember Remy, I think about the incident that you brought up and the tragedy of gun violence, and that experience leaves a lingering effect on everyone. The level of trauma that the community or officers may experience cannot compare to what a mother experiences burying not one but two children at the same time, or the level of trauma that the mothers in chambers today have experienced in burying their children. But I also think about how I will never be able to get those ideas, those visions out of my mind of seeing that level of violence being directed upon little ones who did not even have the opportunity to get started in life. And as we think about how trauma has permeated throughout our community, it's incredibly important to realize that it's not just the responsibility of moms demand action and moms of murdered children or students demand action to advocate on behalf of gun violence. It's every single one of us in this room. It's every single resident in Columbus that demands more for our community. So thank you for saying that. Just very briefly, I wanted to just pull out some numbers, if we could just hone on just a little bit. And if you don't have them now, that's perfectly fine. But do we have an idea, as we're starting to get into the legislation and we're getting ready to have a presentation by our chief counsel here, do we have an idea of how many illegal guns are in our community?
That's a pretty broad question.
Yeah.
Illegal guns in our community, I don't know that we have a good idea of that. I can tell you that to date, officers have recovered 2,864 illegal guns. That's today. Those 2,800, nearly 3,000 illegal guns have led to 1,158 felonious assaults that have occurred in our city this year. About 80% of those from firearms, and that is down about 20% from last year. But that's an extraordinary number.
Yeah.
So I think that just skims the surface on how many illegal guns there are actually on the streets.
And do you have the numbers that are associated with our young folks and their usage of guns in our community to commit violent acts?
Chair Faber, I don't have those specific numbers, but I can get those for you.
Thank you. Thank you very much. And I believe I was also asked a question around just negligence as well, any incidents that might have occurred due to negligence. I know that our doctor highlighted that a lot of the gun incidents he's seeing on a daily basis come from negligence, and I wonder if we have an idea as well.
We do have a number, and I don't have that exact number for you this year because they are not all criminally charged.
Okay.
But we do have a number of gunshot victims that are unintentionally self-inflicted or accidental discharges that strike someone else. And I can get the numbers on how many of those people have been criminally charged. But there's a number monthly that happens fairly regularly.
Thank you.
You're welcome.
We will now move on to the presentation of the proposed legislation that will be done by Chief Counsel Laura Baker Marsh.
Thank you, Chair Faber. Thank you, Chair Remy. Thank you, Council President Harden. I am honored to be here this evening and to present the legislation for Council's consideration. As City Attorney Klein alluded to at the beginning of his presentation, this is but a first step. We are certainly aware that there are other matters that are being considered, but what's unique and interesting about what I'm about to present here tonight is that while we have this initial window of opportunity, given the litigation that's going on at the Court of Common Pleas, some of the matters that we're presenting here this evening may well be able to be defended even if 9.68 is reinstated. And so that brings us particularly why these would come to the forefront first, as Council considers a number of matters related to common sense gun control. So beginning with common sense gun reform legislation, a little bit of background, and this has already been discussed. 2018 is when the General Assembly passed the current version of Revised Code 9.68. This was an amendment of an existing version of that particular code, which was passed in 2010. It specifically is the local government preemption provision of the revised code. The city sued when that occurred. That lawsuit has been pending, and November 3rd of this year, a preliminary injunction was issued by the Court of Common Pleas. That litigation is ongoing. There has been an appeal filed. There has been a request for stay filed. But at this point in time, it's ripe, and it's time to bring forward the ordinances that I'm going to discuss tonight. So the overview. Chair Faber, as you alluded to, there are three large buckets of ordinances that are being addressed, and they are basically qualified as large capacity magazine, safe storage, and straw man. There are a few other components that are related to those three overall topics and overall themes, and we'll discuss that a little bit as we go through the ordinances. But those are the three main characteristics: large capacity magazine, safe storage, and straw man. Just going to jump ahead. So I'm going to talk about large capacity magazine first. This one's pretty straightforward. The proposed legislation would define what a large capacity magazine is. It specifies the kinds of items and devices that would fit within the definition of a large capacity magazine, but generally speaking, it is a device that would allow for 30 or more rounds of ammunition for use in a firearm. There are some exemptions that have been provided for, and there are also some exemptions as to who may still continue to possess a large capacity magazine. Generally speaking, the exemptions relate to individuals that are involved in law enforcement and or military work, and or individuals that have been licensed to carry such firearms for purposes of their state employment, and or individuals who own curio-type pieces that are not actually able to be used anymore. There is also an affirmative defense. One of the issues that has been raised with the city numerous times as we discuss gun legislation is the concern that, well, what if an individual is lawfully possessing this particular magazine in the area of the state where they live, and they're simply driving through Columbus on their way somewhere else? Would they be inadvertently in violation of Columbus law? We have provided for an affirmative defense that allows for possession of these magazines when they in fact are being transported through the city on the way into and out of. There are specifications in the ordinance under what circumstances that affirmative defense would kick in, but we definitely have contemplated the idea that not all cities are in the same position that Columbus is in right now, and we want to make sure that individuals who are lawfully possessing these artifacts in another area are not then violating Columbus law when they are simply passing through on one of our highways. We also included, and I alluded to this at the beginning of my presentation, that there are provisions that we believe would be sustainable even in the event that 9.68 is reinstated. And one of the provisions that we've provided for is this alternative provision in the event that it is reinstated. It is the position of the city attorney's office that there are provisions of the Ohio Constitution that would allow us to defend a high-capacity magazine ban when that high-capacity ban is of a military grade. I'm not going to go into the definition of that right now, but essentially it would be 100 rounds or more. And that 100 rounds is unfortunately the size of the capacity of magazine that was used in the Dayton shooting. This provision would only kick in the event that a court of competent jurisdiction and or the General Assembly's enactment reinstates 9.68. That's large capacity magazine.
I'm going to hop in there real quick
Yes.
so I don't lose the questions. First of all, Chair Remy, do you have any questions? Okay. So first question, you started off talking about the injunction that was issued on November 3rd. Why does this injunction provide the city of Columbus with the authority to legislate in the realm of gun safety in a way that we have not been able to do so before?
Sure. Chair Favor. So the injunction that was issued was to stay the operability or the effectiveness of Revised Code 9.68. It is that provision of the revised code that uniquely prohibits local governments from legislating in this particular area. We always have to be concerned as a local government that we're not in specific conflict with provisions of the revised code, and areas where the General Assembly has specifically legislated regarding firearms, we would still be prohibited from legislating in conflict with those areas of law. However, what 9.68 did was something a little bit more unique. It instead stated a blanket prohibition on any consideration for any level of gun regulation or gun prohibitions by local government, whether or not the state had specifically legislated in that area or not. So the ordinances that we're bringing forth this evening are areas where the state has not specifically spoken other than 9.68. And so these are areas where we feel that we don't have other home rule concerns. Certainly, we're going to have to probably respond to challenges based upon the Second Amendment and general firearms provisions. But these are areas that, because of the lifting of 9.68, we have a little bit more freedom to consider some of these common sense gun regulations.
Thank you for that. Why 30 rounds?
So there have been a number of different cities and states that have already been able to look at this particular issue. Cities outside of Ohio and states obviously outside of Ohio where they don't have the same constraints. And the experiences that have already been challenged or been looked to in those other states would seem to suggest that when we're looking at 30, we're talking about anything over that, anything over that is not the kind of typical capacity magazine that is purchased by users who are using it for purposes of self-defense or using it for purposes of hunting. But in fact, those are the capacities of magazines that are being associated with your firearms that are, that don't have that same level of self-defense associated with it.
What about current owners of large capacity magazines? Are we saying that you need to get rid of that gun immediately?
Well, that's something that the council can consider in considering this legislation. So as it's written, it would be a prohibition if you live in the city of Columbus or you are, bringing it into the city and staying in the city, not passing through. That's something the council can definitely take a look at. What do we want to do with people who currently own them? Do we want to have any kind of a grandfather clause for those individuals? Do we want to give individuals time to get rid of them? Those are things that can definitely be discussed. As written, it is a full ban.
Thank you. And City Attorney Zach Klein, you're welcome to hop in at any point. And I also want to take a moment to recognize our fellow colleague, Councilmember Nick Bankston, as well. Thank you for joining us. Councilmember Remy, did you have any additional? All right, we can keep going.
All right. I'll move on to safe storage of a firearm. So what the ordinance does in the safe storage realm is it does two different things. First of all, it defines what safe storage is. And safe storage is defined in a variety of ways. There are a number of different kinds of devices that can be used with a firearm to assure that it is stored properly and stored in a safe manner. And the city code would contemplate a variety of those devices that are readily available on the market. This definition came from the alcohol, tobacco, and firearms regulations, so it would generally mirror what is defined as safe storage at the federal level. Then what the ordinance does is it creates a prohibition. It prohibits a person from negligently storing a firearm in a manner or location within their residence where the person knows or reasonably should know that a minor is able to gain access to it. And I actually read all the words there rather than just giving the summary because it's really important in each one of those provisions and what it does and does not do. What it really makes clear is that the question here and our focus here is whether or not there is a minor who's going to be able to gain access to this firearm. This is not designed to have every individual who's ever possessed a firearm have to engage in safe storage within their own home, because the goal here is not about the firearm, it's about the child. It's about whether or not there is a minor within that home that has the ability to gain access. And so the idea here is that this would be negligent storage of that firearm within that residence. And if it is demonstrated that in fact you used safe storage, then that would be a defense to this particular allegation of negligence. So again, it's providing an incentive to use safe storage. It's a disincentive to be negligent in the way that you handle your firearms when there's a minor present. And then it is a criminal offense that escalates depending upon whether or not a minor actually comes to possess the firearm. So if there is negligent storage and a minor is present and is able to, but there is no evidence to demonstrate that the minor actually did, that could be a misdemeanor of the 4th degree, depending on the circumstances. If the minor actually comes to possess the firearm, that would be a misdemeanor of the 3rd degree. And if there's evidence that the minor comes to possess the firearm and actually causes harm with the firearm, then it could be a misdemeanor of the 1st degree. Now, mind you, if the minor comes to cause harm, there could be other crimes that would potentially be invoked as well, depending on the facts and circumstances. But this particular provision has an escalation depending on what harm the minor actually causes by coming into contact with the firearm. Related to this are the existing provisions of negligent homicide and negligent assault. These are existing provisions of both city code and state code that deal with negligence, once again, and dangerous ordinances. A dangerous ordinance also includes some firearms. So what this does is does something similar to negligent homicide and negligent assault, whereby it creates a substantial, first of all, it creates a duty. It makes it clear that the storing or leaving of a deadly weapon or dangerous ordinance in a manner or location in a person's residence where the person knows or reasonably should know that a minor is able to gain access, so very similar to the other ordinance. And it's going to state that doing that, leaving it in that way, is a substantial lapse from due care for purposes of the offenses of negligent homicide and negligent assault. And what that means is that if an individual allows their weapon to be stored in a manner such that a minor comes to possess that particular firearm and causes harm, either an assault or a homicide using that weapon, that would constitute a substantial lapse from due care from the owner of the firearm. And then taking the safe storage and applying that. If you can demonstrate that I use safe storage, I used one of the provisions, I used one of the devices that are provided for in city code, that would be then create a rebuttable presumption that that firearm owner was not acting negligently. So once again, establishing a duty of care and then providing an affirmative defense or rebuttable presumption for negligent homicide and negligent assault, and all of these together work in tandem for safe storage.
Thank you. Do my colleagues have any questions? Yes, Councilmember Bankston.
In regards to safe storage, and I think that our youth and children are the priority, but has there been thought given to any other folks in the home or the premises, say mental health issues, or folks that have a past of, say, use of a firearm in a violent crime? Has that been considered, or would that be part of this legislation?
It could be, if council is interested in exploring that particular angle. I believe we presented it as minors primarily because that was the information that was brought to us as being a particular concern within the city of Columbus. We know that we have a problem both with juveniles gaining access to firearms, but we also have a problem with children in the home potentially being harmed by firearms. And so those were facts and circumstances both from our specific awareness of anecdotal information coming from the Division of Police, data provided from the Division of Police, but also within our prosecutors' offices, being aware of allegations of negligent homicide and negligent assault involving firearms. That's not to say that there aren't potentially other individuals that could be considered, and that's something that council could consider looking off of safe storage.
Thank you, Chair Favor. I've heard anecdotally from the division about a lot of guns being found when they steal a car. Mm-hmm. So the automobile owner has a gun, they've left it in the car. How would this legislation apply to somebody that didn't secure it within the vehicle?
So as written, safe storage was only focusing on residences. And requiring that within the home, that it be safely stored if a minor could potentially gain access. Regarding the stealing of weapons and then being in the vehicle, I think we would need a little bit more information from investigations that the division probably has conducted regarding how that came to be there. But one of the things that we should be concerned about is how did a minor come to possess that firearm in the first place? And what you're finding with some of those stolen vehicles with the guns that are being found in them is that it's teenagers who have removed them from the home. And so if that were the case, then this safe storage provision could indeed potentially kick in.
AC Bodker, can you speak to this a little bit? I mean, I'm not asking for specifics because that, I know that we'd have to run through analytics, but but to talk a little bit about this particular issue as it relates to stolen vehicles.
I don't have specific numbers on the numbers of firearms that are contained within vehicles that are stolen. That does happen. However, we also see straw purchasers for firearms, meaning that someone that is lawfully able to purchase a firearm purchases that for someone that is not lawfully able to purchase a firearm.
Thank you very much.
Which is coming up shortly. But before we get there, and this question can open up to anyone who would be interested, and I would definitely be interested in hearing from our Assistant Chief as well. But I've been hearing since we had the press conference that there's an argument that people are less safe in their homes if their gun is locked away. So if someone was to run up in your home and your gun is in a gun locker, safe, gun safe, that's it, in a gun safe, are you putting yourself and your family in harm's way if it's not easily accessible in the kitchen or on your bed nightstand or something?
So I would answer in a couple different ways. First of all, I would say that there's a specific provision of this ordinance that would make clear that it doesn't apply if you are in your if you're in your home and you are possessing it on your person. So if you have it on with you in your possession inside your home, then that would not apply. So we're talking about when you go to store it rather than when you are possessing it within your home. The second thing that I would say is that there are a number of devices that would constitute safe storage. Yes, a gun locker is one of them, and obviously that would be a little bit more challenging to get into in the middle of the night if there was a concern. But the other two devices and the kinds of devices, and I'm going to absolutely take a phone a friend to my right over here in a second, are devices that basically are activated based upon the owner of the firearm having an access either through the fingerprints or through how they trigger the safety. In other words, once they pick it up, it's going to be operable, but it wouldn't able to be operated by the minor. So there are a number of different choices that a gun owner would have to make sure that the home is safe from the minor gaining access to that, but still allowing them to be able to provide some security within their home that they can access that firearm if they truly need it.
And I'll turn it over to our public safety officials. Do you believe that that argument has any strength, right? That if a gun is locked away in whatever device it is, that would lend itself to that gun owner or family being more vulnerable to violence occurring in their home?
Chair Favor, I appreciate you asking my opinion, but I don't know that I have a good opinion on that. I think different people would have different opinions on that suggestion. I do know that we have seen in this calendar year small children obtain firearms that were not only not secured in the household, but were sitting within arm's reach of the child. And that child, from a few years old to teens, injuring someone else either within the household or outside the home with that firearm. Mm-hmm. And those firearms were not secured in any way. They didn't have a gun lock. They were not in a safe. They were not under lock and key in any fashion, maybe just sitting on a table, sitting on the floor. And we have seen that a number of times in 2022.
And I think it's an important distinction that Chief Counsel made around possession versus storage. If it's on your person, you're in your home and it's on your person, versus you being in your home and the gun just laying out for anyone to gain access to. The other question that I have that's to this, last year Council legislated dollars to get gun locks out into our community. And I believe that there are still gun locks that are available at our fire departments and our health departments. While we have officials here, is that accurate? And if that is, how can residents get access to those? Anyone?
At Columbus Public Health, we have the gun lock boxes available here, and they can contact us through the website or our main line, which is 7417, 645-7417. And I also have information this evening available for those gun lock boxes.
Thank you. All right, we can move to the last one.
Okay. The last major topic is straw man sale. It has been pointed out, there is a federal crime against straw men, and there is also a state analog. However, there are legislative holes in both of those particular pieces of legislation that we are hoping to shore up with our straw man ordinance here at the city level. So what it does is it prohibits the reckless selling, lending, giving, or furnishing of a firearm if the seller knows or reasonably should know that the buyer or recipient is purchasing or receiving the firearm for the purposes of selling or furnishing the firearm to a person who is prohibited from possessing a firearm. That's a lot of words, but basically what it says is that the seller has reason to believe and ought to know. I'm selling it to the person in front of me, but that person is clearly here with someone else who is not lawfully able to possess that firearm, and that person in front of me is buying it to give to that person. So that could be that the person who wants to ultimately possess it is a felon. The person who ultimately wants to possess it is a minor who's not allowed to possess it because they're not of age to possess that particular firearm. Those are the kinds of circumstances that we're talking about. And we're looking at recklessness as the culpable mental state. At the federal level, you've got unknowingly culpable mental state, and sometimes it is difficult to meet that particular burden of proof. The federal level, it's a felony with 15 years. Here, we're talking about a misdemeanor of the first degree, and that's why the distinction in the culpable mental state. The reverse of that is also a part of the ordinance. A person is going to be prohibited from purchasing or attempting to purchase a firearm with the intent to sell or furnish that firearm to a person who is prohibited from possessing a firearm. So that, again, of course, is the other side of the transaction, the person who's coming before the seller to try and purchase that firearm with the intention of providing it to someone who is not lawfully able to or allowed to possess it. One last thing I just wanted to bring up while we're here. This is something that changed at the federal level that I know that has been a concern, and that is the ghost guns that have cropped up all over the country. So the ATF issued a regulation in August of 2022 that changed the definition of what constitutes a firearm at the federal level. And they did that in order to try and essentially, I've described it as taking the sheet off of the ghost. So the reason that ghost guns are ghost guns is because they're difficult to trace, because they are pieces of guns that then get assembled and then used. And our registration system doesn't always allow for them to be tracked in the same way that firearms that come as one piece, or not one piece, but come as one firearm are tracked. So what happened at the federal level is that there was a requirement now that multiple parts of that gun are going to have that registration number, thereby essentially eliminating the ghostingness of it and allowing them to be tracked going forward. Now, this is going to take time because, of course, there are existing firearms out there that constitute ghost guns that are not yet stamped with those particular registration numbers. But going forward, if those were to come into contact, we would change our definition of a firearm to also include the concept that these pieces might constitute a firearm as well. So it's a little bit of technical, legal jargon, but that's the intention of it, to make sure that those devices would also constitute a firearm under city code.
Thank you. Councilmember Remy? Oh, Councilmember Bankston. So you've mentioned that at the federal level, there there is a prohibition around straw men, and we are regulating or proposing to regulate it here in the city of Columbus to fill in those legislative holes. Those two holes being, just want to make sure I got them correct, would be the mental state of the individual, and to also capture what could be ghost guns in the future. Am I missing anything else?
Yeah, that's correct. That's correct. Because we want to make sure that our definition of firearm also includes the concept of ghost guns, and that would then apply to any of our existing ordinances that relate to firearms. So it would then incorporate them into our existing weapons under disability as an example, and it would incorporate it then into our proposed straw man.
And then to our public safety officials, do we see ghost guns being a pretty prevalent problem in Columbus right now?
I don't know that I would say pretty prevalent, Chair Favor, but out of the 3,000 firearms recovered this year, 0.8 to 1% of those are probably ghost guns. We have seen an increase in this calendar year, as have most major cities, but I would not call them prevalent.
And you, in your remarks earlier, you did make acknowledgement of the issue that we do have around straw sales in Columbus. How prevalent is that issue, that problem?
Every day of the year, our task force officers are working with our federal partners to investigate and charge straw sales. Those federal crimes carry pretty hefty penalties.
Okay.
And, you know, guns are very prevalent on the streets of Columbus. And oftentimes it is because of those straw sales. Our federal partners, ATF primarily, works very closely with our task force officers and our detectives and NIBIN to identify those firearms and those sales. And they conduct investigations and take enforcement action every day of the entire year.
How helpful will it be for council to legislate, fill in the gaps, if you will, around the straw man provisions, given that important distinction that has been called out from the federal level that we're trying to now fill here on the local level?
I'd probably need to take a deeper dive into that. I'm sure we're missing some straw sales.
Yeah.
But I don't know that if that's based upon volume or numbers of task force officers.
Okay. Thank you. Thank you, Chief Counsel, for your presentation and for allowing us to ask some questions about the proposed legislation. If there are no other remarks, then we will move on to the public testimony portion of this evening. Just a reminder that everyone has 3 minutes. Please provide your name and any organization that you might be representing this evening. There will be a soft ding that will welcome you to complete your testimony this evening. We have 7 speakers on the list, and we will start with Grace Schultz. Following Grace will be Grace Bellamy Jr. Welcome to council.
Hello. My name is Grace. I'm a senior at Ohio State, and I've lived in the Columbus area since I was 6 years old. I've grown up in a time when the threat of gun violence in any public place could be possible at any unpredictable moment. 2 years before I was born, the Columbine shooting happened. When I was 12 years old, the Aurora and Sandy Hook shootings happened. When I was 15 years old, the Pulse nightclub shooting happened. When I was 17, the Parkland shooting happened. When I was 19, in my family's hometown here in Ohio, the Dayton shooting happened. And now as a 22-year-old woman, the Uvalde shooting happened earlier this year. And just in the last week, a shooting targeting another LGBTQ plus nightclub called Club Q in Colorado Springs happened. Sadly, these are just a few examples. There have been many, many shootings in my short 22 years of life. While all of these events have happened outside of this immediate community, the truth is that Columbus could easily be one of these cities at any time. In fact, just as recently as 2020, a young man was caught trying to plan a mass shooting at Ohio State, the school I attend and love. He planned on trying to kill, quote, 3,000 women. He had also purchased weapons, ammunition, and tactical gear. Court documents showed that he had also staked out OSU in January 2020 while planning his attack. Thankfully, he was intercepted and did not commit said atrocities, but that was all too close for comfort. I understand that it's hard to imagine the unimaginable. However, people my age have grown up where we have to just do just that all of the time. From the time we're in kindergarten on, we practice active shooter drills. We see people dying of gun violence in our communities every day on the news, or we ourselves have experienced tragedy due to gun violence. Infringement of rights is always brought up when talking about gun safety reform. I would argue that living in panic of ourselves or our loved ones being shot at any point impedes on our right to life, liberty, and the pursuit of happiness. We all deserve to live in a world where we're not afraid to go to school or work in fear of never coming home. There are common sense gun regulations that most Ohioans support and will save lives. A poll from the Ohio Senate Democrats shows that 62.3% of Ohioans support limiting magazine capacity. High-capacity magazines commonly hold more than 10 rounds at a time. Some of these magazines can cost as low as $8. In mass shooting situations that involve high-capacity magazines, 14 times the amount of people are wounded or killed than in situations without them. These high-capacity magazines are cheap, and they make a gun significantly more deadly. Limiting their sales through these regulations will save people's lives. Do not let Columbus be added to the ever-growing list of tragedies in this country. Pass these common sense gun regulations that most Ohioans want, and once again, will save lives. Thank you.
Thank you for your testimony this evening. And I apologize, Eric Bellamy, Jr. Following Eric would be Michelle Blair. Welcome to council.
Chair Favor, Chair Remy, Zach Klein, and members of council. My name is Eric Bellamy Jr., and I join you today as a gun violence survivor after the murder of my father in 2017, and I'm the state lead for the Brady Center to Prevent Gun Violence. The proposals that were announced on November 9th are all common sense gun violence prevention ordinances that do not infringe on our constitutional right to bear arms in the United States of America. The ordinances that we are hearing are ordinances that I and 80% of Americans from across the country support. For the first time in 30 years, the United States of America, under the leadership of Joe Biden, President Pelosi, and Senate Majority Leader Chuck Schumer, we were able to pass the Safer Communities Act. This law passed nationally at a time when our nation is the most divided that it has ever been. When I joined President Biden and the Brady staff on the South Lawn for the signing of this bill, I had hope. I saw a light at the end of the tunnel. I thought that what we just saw unfold in our nation in a bipartisan way could happen right here in our very own state. But was I wrong when I thought that? Brady, along with the Ohio Coalition to Prevent Gun Violence, which is made up of Amnesty International, Everytown for Gun Safety, Ohioans for Gun Safety, and many other organizations, has urged our Ohio House and Senate to hear bills that protect Ohioans. What do? They pass permitless carry and bills that arm teachers, custodians, and cafeteria workers with as little as 8 hours of training. And the fact is, and let me be very clear when I say fact, we have a legislator that is absolutely controlled by Buckeye Firearms and a Russian-funded terrorist organization, the NRA, also known as the National Rifle Association. Our elected officials who are elected to represent us and our state house, the people of Ohio's house, are brought and paid for by far-right extremist terrorist organizations like the NRA. These folks who are elected to represent us do not care about anything that does not affect their families or line their pockets with cash. We see it time and time again, and we saw it after the Dayton shooting with Governor Mike DeWine and his incompetent Republican colleagues in the State House. I saw my father laying on the ground of his living room floor, lifeless, no heartbeat. I stood at the yellow tape for over 6 hours. I was one of those people that Columbus police had to walk up to and tell me that my dad was murdered, and when it comes to this state, after testifying countless times, I have realized that they don't care. They don't care that my family and hundreds of others that are continuously grieving because of the epidemic of gun violence that our city and, quite frankly, our nation faces. just one more thing. In the state of Ohio, you are required to have a license to hunt, fish, and drive a car. Now you also have a license to kill when it comes to our lax gun laws because Mike DeWine and Republican lawmakers who have special interest when it comes to gun lobby and manufacturers. This is a public health crisis. The state should look at us as so, and I urge you to pass every single ordinance that you can now and ask questions later. We stand with you and support you just like you have with us. Thank you for your time.
Thank you so much for your testimony this evening and for sharing that deeply personal story with us. So incredibly sorry for your loss, but grateful for your advocacy in this space. Michelle Blair.
Good evening, council members, Attorney Zach Klein. My name is Michelle Blair, and March 27th, 2021, my 19-year-old son was killed in the Arena District of Columbus. Ever since then, my oldest son, his brother, has suffered from severe PTSD, finding it very difficult to sleep at night. There seems to be no reform or no justice as far as laws on guns. I am now a part of an organization, Mothers of Murdered Columbus Children, and too many parents who are suffering the same thing I'm going through. I am in total support of the gun reform. Something has to give, and in order for it to be done, all of us have to come together and work together to change the laws. And unfortunately, in my opinion, if you don't agree with that, then you're a part of the problem. It's just too many when kids can just get guns whenever they can. There's too many mothers in the organization, too many. And so many of them have lost more than just one child. Mm-hmm. One of them is here this evening that's going to speak to you. And it's just not fair that there's nothing for the victims, there's nothing for the victim families. Yes, there's the CARE Coalition, and that's absolutely phenomenal, but there has to be more. There just has to be. And that's it.
Thank you for your testimony this evening. Thank you. Lisa Voigt. Following Lisa will be Shannon Danielle Whitus. Welcome to council.
Thank you so much, council members, Attorney Klein. Thank you for allowing me to testify in favor of gun safety measures for the city of Columbus. I haven't had time to review the specifics of the legislation, although I appreciated the overview. I would say my comments are meant to express support for its broad outlines. My name is Lisa Voigt. I'm a college professor at The Ohio State University and mother of a public high school student here in Columbus. I began following Ohio's gun legislation 6 years ago, in 2016, when the Ohio legislature was considering a bill that would allow universities to permit guns to be carried on campus. I was shocked to learn of the consideration of such a bill. But since then, I've seen the Ohio legislature pass even more dangerous bills that allow more guns in more hands in more places, including permitless carry, stand your ground, and allowing teachers, staff, and volunteers to be armed in K-12 schools. Universities like Ohio State are still allowed to prohibit students from carrying guns on campus. But it was not long after that bill passed that I learned that a student of mine had impulsively purchased a handgun and expressed to his friends that he was afraid he might use it to shoot innocent people on campus. Fortunately, he sought help. But what might have happened if he had been allowed to carry a gun with him on campus is a question I think of whenever we hear about another school or campus shooting, which sadly seems to be nearly every day in this country, and most recently, the horrific shooting at the University of Virginia, which somehow has now been superseded by the even more recent hate-fueled mass shooting at Club Q in Colorado Springs. As you all know, Ohio now has some of the weakest gun laws in the country, with no law requiring background checks on unlicensed gun sales, no law prohibiting domestic abusers from possessing guns, no red flag law that would allow law enforcement or family members to petition a court to temporarily prevent someone in crisis, like that student of mine, from accessing guns. We know the consequences. Ohio has 3 times the rate of gun violence of the state of New York. 3 times. It has nearly twice the rate of gun violence of California. I should specify gun deaths. These are states that have the strong gun laws like the ones I mentioned, and of course they have large cities, like cities much larger than Columbus. So I applaud the City Council for taking upon itself what the state legislature has been unwilling to address. I'm particularly grateful for your consideration of the prohibition on high-capacity magazines. That enjoys the support of, as we just heard, 62.3% of Ohioans, according to a recent Baldwin-Wallace University Ohio Pulse poll. The secure storage requirement, studies have shown, would dramatically reduce the risk of youth suicide and unintentional firearm injuries, as we've heard about. And in cases of gun violence on school grounds, up to 80% of shooters under the age of 18 obtained guns from their own home, so it would also help in that regard. So thank you so much for taking this step. We know there are more to take as well.
Thank you for your testimony and continued support and advocacy. Following Shannon, we have Shannon Sever. Did I mispronounce your last name?
Waitis, it's okay.
Waitis, my apologies.
I'd like to thank you all for having me here tonight. I am a mother of 5. I work in foster care at the Buckeye Ranch, and I also volunteer as an advocate for gun violence survivors and suicide prevention. On October 6, 2014, my family was shaken by gun violence. My estranged husband, John, had a history of abuse, mental illness, addiction, and suicidal ideation. We split up, but his abuse continued. He would come over to my home with his handgun and threaten me and my new partner, Robert. When he called me to tell me that he had planned to take his own life, I did everything I could, everything I could think to prevent his access to a gun. I called my local police department, who told me to call the sheriff's office. The sheriff's office told me there was nothing they could do. They told me to call the hospital that he was currently at for an unrelated medical condition. He was seen by psychiatric department there, and they still released him, saying, again, there's nothing they could do. 2 days later, he came to my home and committed a murder-suicide first thing in the morning. Our sons were in the next room. My daughter went out her bedroom window to call 911. My other daughter had thankfully just left for school that day. Nobody could tell me to contact a judge to request a petition to remove his guns while he was in crisis, because Ohio does not have an extreme risk protection law. It's not long after John showed up at my house armed for the last time that he ended up shooting Robert twice, once in the back of the head. Robert died while being airlifted to the hospital. John shot at me, but thankfully missed, and then he shot and killed himself. My family's still healing from our shared trauma, and tragically, our story is one of so many. More than 1,500 people die by gun violence in our state every year, and there are solutions to this senseless violence. I know that the regulations that you're considering may not have prevented the tragedy that we experienced, but they can save other lives. I especially want to express my support for the secure storage resolution, which can protect children who might otherwise have access to firearms in the home, and has been proven to lower suicide rates if weapons are properly stored. As Lisa said, Ohio has some of the weakest gun laws in the country, even though the majority of Americans and Ohioans support gun safety measures. This is a bipartisan area where you can find support across the board. I would like to thank you all for your support. I'd like to thank you for your leadership in providing me space to share my story today.
There are no words.
Yeah, I know.
There are no words. all I can say is thank you for allowing this tragedy that occurred to you to advocate for those who can't be here tonight. And no one should experience the type of loss that you experienced.
I agree.
And you were proactive. You were proactive. Thank you for sharing your testimony this evening. I want to respectfully ask our public safety officials that if a resident finds themselves in a situation where they know that someone could be in danger to others, could be having a mental health episode or any of those things, and they do have access to guns, is there anything that they can do right now in Columbus?
Our officers respond to those calls daily. Additionally, we have mobile crisis response officers that are teamed with social workers since 2018 that respond to those calls daily. Last year, they responded to about 3,500 people in crisis calls. Some of those people were armed. And if they are able to safely remove those firearms, they do so. I don't know that you are in Columbus, but
I was not.
we respond, as you know, Chair Favor, we respond to over 1 million calls for service a year.
Yeah.
And a large percentage of those are either people in crisis or armed individuals.
And you know, this testimony also brings up another conversation that we've been having around red flags. And I'm wondering, Chief Counsel, if you could speak to just red flags in general and our thought process around that in Columbus.
So, Chair Favor, red flag laws are a little bit more challenging. Doesn't mean that's not something that should be explored. What's challenging about them is even if 9.68 is declared ultimately unconstitutional and is no longer effective in a permanent way, red flag laws, we also have to figure out how a local ordinance would be able to avail itself of the judicial process in order to have firearms removed. The ideal would be if the state were to act in that space, because this General Assembly does have the authority to deal with the jurisdictional question related to the courts. But that doesn't mean that we shouldn't be trying every avenue that we can explore to see if there's anything that we can do on a local level.
Absolutely. Thank you, Ms. Shannon, for your testimony this evening. Shannon Sever? My apologies, Wayne Sever? Wayne? Ms. Sheila Blanchard? No, they put the two names wrong. Welcome back to council.
Council members, Attorney Klein, they've already said everything. I will say a couple things. Since the murder of my niece, August the 4th, 2019, at the Dayton, Oregon district, I've been to Senator Portman's office. I've testified against dangerous gun bills at the Ohio State House. I've shared my story in this House and also shared my story with U.S. congressmen in D.C. We were, with some bipartisan efforts, able to pass the Safer Communities Act that passed this past summer. Ohio, unfortunately, is under attack. You've already broken down very well the statute that we're under, ORC 9.68. I had some definitions here because a lot of people in our community, I think, don't understand what that means when it comes to what does that mean? What does that look like? How does that affect us on a daily basis as we're going about our daily lives? So I'm very thankful that you're bringing that to the community so that they have an understanding of exactly how that affects us on our daily lives. One thing I did want to point out is that economically, gun violence costs Ohio $22.3 billion each year. And of that, $493.7 million is paid by taxpayers. I would rather my hard-earned money go to struggling families, paying for job training, and other things that could be more beneficial to struggling families and job readiness and other things that could be more beneficial to our communities. I know that no matter what the naysayers will say about these ordinances, that this is an infringement upon their rights. If you do the right thing, how are your rights infringed upon? How many more have to die, is my question to them. I say to that sir or madam, what about the rights of the child or adult that were gunned down because of who they love or their lifestyle, where the perpetrator's warning signs were overlooked and records were sealed, like my niece's perpetrator in Dayton, his record was sealed? What about the curious child's right that died because a gun was left unsecured? What about the woman in a domestic abusive relationship that's killed by her abuser? What about their rights? They have rights as well. So I thank you for pursuing these actions. We know that it's going to be a hard-fought battle, but as an advocate, we'll be here to support you. Thank you very much.
Before you leave, because I don't think people understand that this has become your life's work.
In addition to my full-time job where I
In
pay
addition to your
taxpayers'
full-time
money,
job.
and I don't like my money being spent on this cost, but anyway, yes.
But you rattled off, a dozen or so different spaces, public hearings, offices, testimonies that you have provided since this unfortunate incident happened with your niece. It has essentially become a full-time job for you. And I just want to say thank you. You have been, along with all of the other mothers, working collectively and individually to ensure that this legislative body is aware of the position that you all share, but the work that you're doing on a daily basis, advocating for Columbus residents at the State House. Thank you. Thank you for the work that you continue to do and the advocacy that you continue to do. So that needs to be said.
Thank you.
Before we close out, just want to provide an opportunity. I'm going to put you on the spot, Councilmember Bankston, because this issue is incredibly personal for you.
Thank you, Chair Favor, and I think that you were reading my mind because I did want to speak to that. And it's a unique perspective for me. So I'm a victim and survivor of gun violence, but I also, too, am a gun owner. And when I think about this issue and I think about what we are contemplating here at the city, it's common sense. And it kills me every time I hear folks talk about infringing on their rights and what this will do and the trickle-down effect and the fear-mongering that goes into it. Every single constitutional right that we have, every single one of them, has parameters, guardrails, regulations, whatever word you want to fit in there that makes you feel good. Every single one of them has that. But yet when it comes to the Second Amendment, it's supposed to be unfeathered. And I want to be very clear. It was someone who shot me, yes. But guns do kill people. People kill people too, absolutely. But guns kill people. When I think of that child who picked up that gun, are we saying that she intentionally chose to shoot herself? What we're talking about here today is locking your gun up, making sure that it's safe, so that children don't die, so that folks that have mental health crises don't have access to it to go out and cause chaos. Or this idea that we just need more folks with more guns. There were over 100 officers outside of a classroom in Uvalde, Texas, that had more powerful guns than the man inside the room, and yet nothing was done. It's personal for me because it's unnecessary. It's unnecessary for you to have an assault rifle in the city of Columbus or in any city. And if you need that to hunt, you're a terrible hunter. It's unnecessary for you to have a high-capacity magazine. For what? You're a terrible shot. This is common sense stuff, folks. I want to protect my family. And I do that. But I also know what it means to be on the other side of that barrel, of that illegally purchased gun. And how do I know that it was illegally purchased? Because the person who shot me was 17, like I was. So what we're talking about here today is going to save lives. So I want to talk to an audience of people that we sometimes don't talk to in these cases. If you're a gun owner, if you're a gun advocate, stand up, speak out, and stand with us. These are common sense solutions that 90% of us agree on. Stand up and stand with us. This is not about taking away anyone's rights. This is about putting guardrails and regulations on a right that has gone unchecked in this country, in this city, and in this state for far too long. And I need your voice. I don't need you to answer the poll and say, yes, you agree with it, and then sit silent behind the NRA and other folks. I need you to stand with us so that not only that we protect our community, but we protect responsible gun owners like you and I. So thank you, Chair Favor, for your courage, for your leadership. Thank you, Attorney Zach Klein, for your courage to stand up, to continue to push, to find the loopholes, because we live in a state that for some reason wants to regulate people's bodies, but then give folks weapons to kill each other. And I don't want to dive and go into politics. This is not about politics for me. It is personal. It is not about politics for me. It is about people. At the end of the day, this is not a black issue. This is not an inner city issue. This is not a Republican issue. It's not a Democratic issue. This is an Ohio issue. And if our state house is not going to do something about it, we, the people of Columbus, should be able to stand up and say that we're going to do what's necessary to protect our community and protect the next generation. So thank you so much for holding this hearing. Thank you so much for those that testify. And for those, again, who maybe you're reluctant and you're just sitting here wondering what it is that we're talking about. There's no secret curtain back here.
Yeah.
It's common sense stuff. Mm-hmm. Come to the table, be a part of the conversation with us. Not someone who wants to continue to allow these mass shootings to continue to happen. Because they are not one-offs now. They are becoming the norm. And yeah, it may be an AR-15 today. Could be a handgun tomorrow. And the young lady said it so profoundly that every day when I watch the news and I think about how blessed Columbus is, there is nothing that makes us different than any other community. It could happen right here.
Yeah.
So I need you all to stand up and stand with us on common sense things that we all agree on. And that's all I have to say. Thank you, Chair Favor.
Thank you,
And
Councilmember Bankston.
Safety Chair Remy as well.
Councilmember Remy.
All I want to say is that I'm very proud to serve with my colleagues and take up this issue. You know, when you look at the statistics, and again, back to the common sense piece of this, when you look at the statistics in 2020, the last time the statistics are available, there were 45,222 deaths in the U.S. 24,292 of them were suicides. 19,384 were homicides. These gun laws that we're proposing, again, again, you can't get more common sense than this. Lock your guns up, keep them safe, keep them away from children and people that are suffering from mental illness. Make sure that we don't have people out there with 100 bullets in their guns so that they can go take care of, mass audiences. And let's limit, if somebody's going to illegally, already stated, illegally sell a gun to somebody else that is asking for it, then we're going to say no here in the city of Columbus. And this is only the beginning. But this is, to Councilmember Bankston's point, it's time that people stand up and do something about this type of stuff. When is enough enough? This country, there are 120 guns for every 100 people in this country. It's insane, the death rates from guns compared to every other civilized country in this world. Yet, no one has the courage to stand up and do something. So I'm very proud to sit here tonight to contemplate this legislation. I want to thank Chair Faber for her work in this. I want to thank Council President Hardin. And certainly want to thank Columbus Public Health, A.C. Bodker, Deputy Chief Smith-Weir, our former council member and Chair of Public Safety, Mitch Brown, who had been very staunchly in this camp as well, and others who have worked on this from day one. It's just the first part of this package, one of many steps that we must take to make sure that our streets are safe in the city of Columbus, and for our fire and police and all of our first responders, when they arrive at a scene, we want to make sure that they're arriving in a situation that they're going to come home at the end of the night. So thank you, Chair Faber. I appreciate the opportunity.
Thank you, Councilmember Remy. Thank you all again for being here tonight for this very important community conversation. Just 5 months ago, we hosted a vigil here to recognize Gun Violence Awareness Month. That night, we listened to and we spoke to families and friends who had lost a loved one to gun violence. We stood here in chambers, and most of us felt helpless, but we were ignited. We were ignited in our resolve to continue to fight. And I think about the testimony of the young lady this evening, who's now age 22, if my memory serves correct. And her entire life is she can pinpoint a space and time where there has been a mass shooting from her formative years. And that night, during our gun violence awareness vigil, one of our advocates put on an amazing but gut-wrenching, interactive demonstration that included our youth in our community. And for every gunshot that had rang out in an incident, I believe over 30, each of the students would fall to the ground. This was in chambers. And I'm thinking about the fact that our youth are taking up this cross that we as adults should be able to press forward on. That these are, as we keep saying, common sense pieces of legislation that whether you are in support of guns or oppose guns should at least recognize that there should be responsible ownership. Mayor Ginther said it earlier tonight, that a constitutional right is not a license to act without responsibility. With a right comes responsibility. And so I am tired of going to funerals. I am tired of our mothers and our family members coming before this legislative body and looking to the seven of us to do something. Well, tonight we're doing something. And we are not naive to think that this is going to cure gun violence in the city of Columbus, but it is a step in the right direction in creating a safer Columbus for us all. So I want to thank my colleagues for being here this evening, Mayor Ginther, City Attorney Zach Klein, Council President Shannon Hardin, Council Member Remy, Council Member Bankston, Assistant Health Commissioner Anita Clark, Dr. Deshpande, and Assistant Chief Gregory Bacher for your testimony and your advocacy this evening. And thank you to our residents, and more importantly, thank you to all of our advocates who has unfortunately lost someone to gun violence. May this be indication, evidence, to please not give up hope. We are here today because despite the fact that we were unable to pass legislation around guns in the state of Ohio, we were still working on legislation. You know, it's the old adage, get ready, stay ready, so you don't have to get ready. Well, we were ready. We were absolutely ready for this moment in time, and we could not have done this work without some key folks. So Chief Counsel Laura Baker Morse, thank you for all the work that you have done over the past 2 years. Legislative Research Officer Naya Walters, thank you for your work. To my team, thank you for the work that you have done to get us here. And to Council Member Remy's team as Chair of the Public Safety Department, thank you for all of the work that you have done thus far. This will now conclude our hearing for this evening. Thank you.